Opioid-related deaths are on the rise. We're seeing an increase in numbers upward around 20,000 annually. Additionally, the conventional medical treatment approach does little, if anything, to resolve pain issues, often making the problem worse. Why is this a growing problem? Well, I'm about to tell you, so stay tuned and find out. I am Dr. Victoria Munoz, and I specialize in regenerative medicine. Regenerative medicine is a specialty area of medicine that serves to heal and repair the body and reverse aging by providing the tools to stimulate the body's intrinsic ability to heal. My goal as a doctor is to educate, heal, and reach the masses with the message of regenerative medicine. By March 2021, there had already been over 96,000 opioid-related deaths reported in the United States. This is up from 74,000 just 1 year prior. Prescribing opioids is the most common treatment approach to acute and chronic pain in the United States. In addition, patients are offered options of corticosteroids through injection or by mouth, nerve ablation, and surgery, none of which solves the problem and commonly makes the root problem worse. When I began writing my book, The Pain Solution, the statistic for opioid-related deaths in the United States was 70,000, and this was 2017. Today, we have reached an all-time high of nearly 100,000 deaths in just 1 year due to opioid overdose. Now, to clarify, the statistics come from the CDC Wonder website and includes heroin, natural opioid, synthetic opioid, fentanyl, methadone, and similar type substances. Today, we are going to look at pain as it relates to the musculoskeletal system, such as back pain, knee pain, neck pain, etc. However, pain can also be related to other pathologies such as metastatic cancers, rheumatoid arthritis, and diabetic neuropathies. The primary care physician, or PCP, is typically the first stop in a patient's attempt to get answers for their pain. Rarely do conventional medical doctors take the time to thoroughly evaluate the patient by doing a physical exam or ordering imaging. It is typical for the patient to leave with a prescription, a referral to pain management, or a recommendation of the use of NSAIDs, which are non-steroidal anti-inflammatory drugs such as ibuprofen, Advil, etc. If the patient's lucky, they may get a referral to a chiropractor or physical therapy, maybe an x-ray, but rarely is the root problem causing the pain addressed to begin with. Once a patient is referred to pain management, the protocol is opioids, corticosteroid injections to the painful joint, nerve ablation after corticosteroids prove ineffective, and then ultimately surgery. Patients will spend years on these opioid medications, becoming unknowingly addicted because they put their trust in their doctor. People are becoming sick and tired of being placed on a treadmill of sick care where real solutions are rarely discussed. Let's look at each of these treatments in detail. We've already discussed opioids. Corticosteroid is basically a steroid medication that is injected into a painful joint for the purpose of reducing the inflammation. It also serves to suppress the immune system and is very caustic to soft tissue. After a series of these injections, the integrity of the soft tissue, which was already damaged to begin with, becomes very frail and is prone to tearing and degeneration. The increase in damage to the soft tissue causes increased pain, leading to the next step, which is radiofrequency ablation, also known as RFA. RFA is essentially burning the nerve just below where the pain signal is initiated in order to block that signal. These treatments do wear off after 4 to 6 months because the nerve grows back, and procedures need to be repeated. In some cases, the right nerve is not ablated and the patient does not get relief of pain. The procedure is arduous and requires anesthesia. Because conventional medicine offers very little, if anything, to resolve these issues, surgery is the ultimate goal. Sometimes surgery is indicated, but it tends to be overprescribed for this reason. There are a few things that are common with surgery, such as the development of scar tissue and weakening of the joint. As in the case of surgery to the lumbar spine, discs and part of the vertebrae, as in a discectomy or laminectomy, are often trimmed or removed to relieve pressure off the nerves. If levels of the spine are fused, the discs above and below that area are prone to herniating, ultimately requiring additional surgeries. If we're talking about a knee joint, for example, ACLs are repaired, meniscus are trimmed or removed, or the joint is replaced altogether. An artificial joint will last for only about 10 to 15 years, and then a second joint replacement will be required, typically leaving the patient with more problems. So in any case, parts of the supporting structures of the joint are being removed, causing a weakening in that joint and a lack of support for proper movement. This additionally causes pain. NSAIDs are often thought as safe to use because they are over the counter. This couldn't be further from the truth. These medications are used to reduce inflammation and pain. However, they also suppress the immune response, cause deficiency in kidney function, and inflame the gut. And if you think about it, the immune system is developed in the gut. When the gut is inflamed, we end up selling our immune system short and don't heal from injuries. So you're probably wondering what the answer is to these issues. Well, in our next episode, we will begin talking about regenerative medicine and how it's offering real solutions to relieve pain and heal the body. If you'd like more details and would like to get a head start, you can purchase the pain solution. You will find 2 links in the description below. One is to purchase the book from Amazon. The other link is to message us directly through my website to request a signed copy of the book for no additional cost. I am Dr. Victoria Munoz, CEO and owner of Regenerative Sports Medicine and Anti-Aging, where we've been rebuilding bodies since 2017. Until next time, take care. So before stem cell therapy, athletes pretty much had the option of a steroid injection or surgery. The competitive athlete pushes their limits beyond what the human body was meant to do. How stem cell therapy can benefit that is that it can help to repair the damage they're doing to their bodies on a daily basis. And that's the great story behind these successful teams, stem cell therapy.